This device is used to endoscopically ligate esophageal varices at or above the gastroesophageal junction, or to ligate internal hemorrhoids. Note, this device is supplied non-sterile. Do not use this device for any purpose other than the stated intended use. If the package is opened or damaged when received, do not use. Visually inspect with particular attention to kinks, bends, and breaks. If an abnormality is detected that would prohibit proper working condition, do not use. Please notify cook for return authorization. Store in a dry location away from temperature extremes. Contraindications are those specific to primary endoscopic procedure to be performed in gaining access to the desired banding site. Those specific to esophageal banding include, but are not limited to, cricopharyngeal or esophageal narrowing or stricture, tortuous esophagus, diverticula, known or suspected esophageal perforation, asymptomatic rings or webs, coagulopathy. Those specific to hemorrhoidal banding include, but are not limited to, severe inflammatory bowel disease, portal hypertension. Use of ligation bands is contraindicated in patients with known hypersensitivity to latex. Potential complications associated with gastrointestinal endoscopy include, but are not limited to, perforation, hemorrhage, aspiration, fever, infection, allergic reaction to medication, hypotension, respiratory depression or arrest, cardiac arrhythmia or arrest. Those which can occur with esophageal banding include, but are not limited to, retrosternal pain, nausea, laryngeal laceration, esophageal perforation, stricture formation, obstruction. Those which can occur with hemorrhoidal banding include, but are not limited to, severe pain, bleeding, urinary symptoms, swelling and edema, tissue ulceration, bands slipping off. Hemorrhoidal banding may result in severe pain if the procedure is performed below the dentate line. Precautions. Refer to package label for minimum channel size required for this device. Band ligation may not be effective when applied to small varices. Esophageal ligation devices are not intended for ligation of varices below the gastroesophageal junction. Current literature addresses management of acutely bleeding esophageal varices and does not address prophylactic use of banding. Passing an endoscope over a previously placed band may dislodge the band. Prior to assembling the device, routine endoscopic examination is recommended to confirm diagnosis requiring treatment of esophageal varices or internal hemorrhoids. Use of an endoscope in a sound state of repair is a prerequisite for a successful multiband ligation procedure. It is vital that the integrity of the working channel is intact, as grooves or other obstructions in the channel can potentially cause the device string to catch, resulting in band deployment difficulty.